Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your community-owned hospital. As you know, if you've watched this show before, every week I have a different guest on the program, and we talk about different services, programs, physicians that we have here at KRMC. I know there's things that are going to be of interest to you and your family, so stay tuned. We'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Dr. Christopher Johansen. Thanks for being on the show today. So, Dr. Johansen, you've been in Kingman 2 or 3 years now?
3 years now.
3 years, because we had you on the program right after you got started, so time flies when you're having fun.
Absolutely.
Now, you're a radiologist, but you have a specialty. Let's talk about that first.
Right. So, like the rest of my group, I did a general radiology residency at the Mayo Clinic in Minnesota.
Okay.
Following my general radiology residency, I pursued a further year of dedicated breast imaging training.
Okay.
And during that year, I was able to do nothing but breast imaging, working on various techniques to find and detect breast cancer at the earliest possible stages when it's most treatable.
Great. And now, where was that at? Where did you do that training?
That was in Boston at Massachusetts General Hospital.
Okay, very good. And was it there then that you learned about the 3D tomosynthesis?
Absolutely.
Okay.
That was actually the institution that originally came up with the idea for tomosynthesis, and then pioneered the idea with Hologic, a breast imaging company. They were using the technique even prior to its admission by the FDA into the United States. So I was very blessed. I was able to
literally at the ground level.
Exactly. I was one of
Awesome.
the first 20 private practice radiologists in the country trained and certified to use the technology.
And we got you here in Kingman. Boy, talk about blessed. That's awesome. So I know that, did we get the 3D like right around the time you were coming? So we knew you were coming and we baked a cake. No.
No, absolutely. It was right after I arrived is when we got it. We were actually the second site in the Southwest in California, Nevada, and Arizona. We missed being first by just a couple of weeks to a site in Phoenix, but even today the technology is not as widespread as one would like, unfortunately, because it's expensive and because it doesn't add any billing cost to any of the tests. It costs the same to do this as it does to do a regular 2D mammogram. Many sites aren't able to put the financial commitment to acquire the technology. Besides Phoenix, we're actually still the only site in the Southwest outside of Los Angeles and Phoenix to have the technology.
So there's just 3 in the whole
Exactly.
Southwest.
There's a VA in Las Vegas that does have the technology as well, but of course that's not available to the public if you're not a member of the military services.
Well, we're blessed, and we just have to do, I think, continue to do a good job of getting the word out to the women in our community, not even just in our community, but this whole area about this, because 3D tomosynthesis, let's talk about that. What makes it so much more special than a regular mammogram?
It's a very exciting technology. Traditionally, looking at the breast with simple 2D imaging was able to detect some cancers, but of course there were other cancers that were hidden by normal breast structures and were not able to be detected by mammography until they became more advanced. Additionally, there are normal breast tissue structures that, when they're superimposed, when you take a 2D picture of them, they can look like a cancer. And that means we have to have you come back, do additional tests and additional imaging studies to figure out that it's just normal breast tissue.
Wow, so that gets kind of scary, because the woman gets called back, they're not sure.
You have to come back, there's additional time, additional expense, and of course there's a lot of emotional hardship and wondering, what does this mean? Is this going to be something bad? With tomosynthesis, the evidence continues to mount that it not only detects more cancer, which of course we love, finding cancers that otherwise wouldn't have been found.
Or not as early.
Exactly, not found until they were advanced and possibly not able to be treated. It also decreases the number of cancers, the number of callbacks, the number of times a woman is asked to come back for further tests for something that doesn't turn out to be important.
Right. And like you said, that scare factor. I mean, of course, it's better to be safe than sorry. You'd certainly rather have to come back and find out, no, it's not, than to not have that happen.
Absolutely. But anytime you can have a technology that doesn't cost your patient anything more and both finds more cancers and reduces the number of false alarms, that's a win-win situation for everyone.
Absolutely. And then you were sharing with me before the show about the lower level of radiation now?
Absolutely. Radiation is always a concern, especially in a screening test. We want to make sure that, of course, we're doing good and not doing harm.
Sure.
There's new technology that's just come out for 3D tomosynthesis, which allows us to acquire both the traditional 2D and 3D image with less radiation than what it takes to acquire a 2D image on a regular machine, on a machine
Wow.
that's not 3D capable.
That's amazing. Now, how do they do that?
Well, the way
Do you know?
I do actually. They take 15 incredibly low-dose mammograms,
Okay.
and we use those to make our 3D images.
Okay.
Traditionally, you had to take a 2D image separately, and the 2D image actually had more radiation than all 15 of those 3D images put together.
Wow.
Now, we're able to reconstruct a 2D image out of the 3D images, allowing us to completely forego all the radiation associated with a 2D image. So now, with this technology, you can have the 2D image, all the 3D images, and less radiation than if you were to go to a machine that simply did 2D imaging.
Amazing. Modern technology just keeps getting better.
Absolutely.
That's awesome. Well, and like you had mentioned earlier, what I'm very proud of KRMC and its commitment to our community and to our patients, that it sees the value of investing in that equipment. Like I said, it's been 3 years ago now that when we did that, but certainly that's a long-term investment in the health of our community. And we all know that catching it early, even, and it's fun because that's the name of our special program, but it also is so true, the importance of catching these cancers early, when you can actually do something to eliminate that versus it going too far and too late, by the time they find it, it's too late to help. So it's amazing.
It's very exciting. Of course, as we know in breast imaging, cancers that are caught when they're very small, when they're early, before they're even apparent on a physical
Right.
exam,
Yeah.
can oftentimes be treated with an incredibly high cure rate, over 90 or 95%.
Wow.
And we can treat those cancers in just a matter of weeks with our least invasive techniques. Women that have these small cancers have all the different techniques available to them if they want to just remove the cancer and spare the rest of their breast tissue, or if they choose to have a full mastectomy, all the options are available to them.
That's
Unfortunately,
wonderful.
when women don't have an early cancer, when
Right.
their cancer is found later, some of these options are no longer available.
Right.
Our cure rates continue to drop the larger a cancer gets,
and
we
the
have
longer
to use
it's been in your body, obviously.
exactly the
Yeah.
larger it gets, and the longer the longer it's been in your body, and the techniques we have to use to get these lower cure rates are more invasive and more unpleasant. Things like chemotherapy, things that are expensive, take months to do, and are unpleasant to undergo.
Right. I've always said sometimes the treatment's almost worse than the,
Well, for the very advanced cancers, that
Right.
can be the case.
Yeah.
That's why mammography is so important, because it helps us to detect cancers when they're small, when we don't have to use those things, when the cure is still relatively simple,
And I
easy, and quick.
I think that's a really important message that we need to get out to the women, is that, they might think, well, we talk about the denial syndrome, if I pretend it's not there, maybe it'll go away. But the other side of that is, truly, if we do catch it early, their chances of living a long, full, productive life to dance at their grandchildren's weddings kind of thing is
Nears 100%.
Right.
And really, when caught early and appropriately treated with the kind of multidisciplinary care that we have here at KRMC, where all the different doctors are under one roof, you're not going around to various different offices, but rather the surgeon, the medical oncologist, the radiation oncologist, the radiologist are all together to
It's a whole
share their
team.
insights and
Yeah.
work together to treat your breast cancer. It can have virtually no impact on lifespan at all. It can be
Wow.
truly, in the most true sense of the word, cured.
right. And that's just, it's still mind-boggling when you think about it, because most people still think, oh, the big C, and they think they get that diagnosis and it's a guarantee they're going to die.
Right.
And that's not the case anymore.
Absolutely not anymore,
Yeah.
especially when these breast cancers are caught early.
Right.
Like you had mentioned before, we're very lucky that KRMC has invested in these technologies. These technologies don't bill anything. You'll pay the same for a 2D, 3D mammogram that you would for a standard, old-fashioned
Regular
2D mammogram,
mammography,
even
yeah.
though 3D mammography has all these benefits like we discussed. KRMC is a nonprofit hospital, of course.
Right.
We're the only nonprofit hospital in the region,
Yep.
which allows them to have a lot more flexibility. They don't have shareholders
Right.
waiting
They
for
don't
money.
report, yeah.
Exactly. They can take all their money and turn it back into better technologies and better physicians and just
Yeah.
better care overall for the local patients.
Absolutely. And we do have these special programs, the Catch It Early, as well as the discounted memos that we're offering. You reminded me, I'd forgotten about that. We do it twice a year now. Or we did this year. We were able to do it in May for as a Mother's Day, kind of give your mom a gift of free good health by giving her a mammo. And then in October, of course, we really push for those mammograms.
Absolutely. October, of course, is Breast Cancer Awareness Month,
Right.
so all across the country you'll see all sorts of events and symbols of breast cancer awareness out on display. We were concerned in the past when we participated in, like many hospitals, offering low-cost mammograms in October, that we weren't able to make them
Catch
available to all
everyone.
women. There's a
Right.
huge need for mammography, and even with our screening rates, which need to come up, we were not able to accommodate everyone in October. So we decided, with the hospital fully supporting us, to offer low-cost mammograms in May to help take some of the burden off the October schedule
group, right.
and allow more women to benefit from low-cost
Those that
screening.
missed out.
Exactly.
So that's awesome. And it is something, and I had Jennifer Rosebrock was on the program last week, and we were talking about like the Well Woman program, and that there are options out there for these women who just probably aren't having it done either because they have no insurance or they have such high deductibles.
Right. It's
or
cost prohibitive
It
with their
is,
insurance.
yeah.
Another way that KRMC has really gone above and beyond to support women that need some help getting their mammograms. These programs are available, and many of them are excellent, but they can be complicated to navigate.
Yes.
So we have a specialized person here for any patient that is confused by these programs or doesn't know where to start. They can simply call the hospital and talk to Jennifer.
Yep.
She'll help them find out which programs they're eligible for, assist them in actually navigating all the paperwork and rigmarole that goes into having them done, and then eventually helping them to get their mammograms. For those women that then have a positive mammogram, she's there with them every step of the way so they never have any questions, minimizing stress, helping to arrange things so that they can be treated efficiently and effectively and with the minimum amount of emotional distress.
Right. She and I talked about the fact that she's made a lot of new friends in the past year because it becomes a personal engagement with her, that one-to-one that she does with these patients, and literally kind of help hold their hand and walk them through that process.
Absolutely. She's just wonderful at it.
Yeah.
And when she gets people signed up for these programs, their benefits, of course, go beyond breast health. Many of these programs will pay for other aspects of medical care, both preventative care and for acute illness care. And unfortunately, a lot of times if people wait until they're actually sick or in need of these programs, it's a lot more difficult to sign up for them. If they sign up for them early, then they're ready to go when they need them later on.
Yeah. And that's, you know, again, that denial syndrome. We have a tendency to, oh, it's not going to happen to me. And even if you are good about doing your yearly mammos and doing the exams, I have a couple of friends who, through their yearly exams and through their mammograms, found small, I mean like fingernail size, cancer deep down, and I think you had shared with them if, you know, another option, or if they'd done it another way, it probably wouldn't have shown up on just a regular 2D for a while. So again, the importance of catching it early, and they went just flying colors and came right through it. So just reinforcing again how important it is to catch it early and deal with it and go on to live a long, full life.
Absolutely.
It's very important. One of the things you kind of touched on earlier was our team approach to healthcare. I know that our partnership with Mayo Clinic continues to get stronger. Can we talk a little bit more about that and
Absolutely.
what we're doing?
So in the old days, medicine was much more fragmented. It used to be, back in the 50s, 60s, standard of care for someone to go to a doctor in one office to get one aspect of their medical care and then go across town to a different office. That used to be the way things were done. We know nowadays that that's a recipe for disaster because every time you go from one office to the next office, there's a chance for a mistake to be made, for the
lose
ball to be
records
dropped.
or not getting the full story.
Exactly, and that's what led places like Mayo and Massachusetts General Hospital to pioneer the team concept in medicine, where many doctors, all working under one organization, are able to closely interact and bring all their different specialty knowledge to bear to give the maximum amount of benefit to their patient. That's the model that KRMC has been trying to emulate and has been making a lot of progress in bringing lots of different physicians together working together all here at the hospital to, again, give the best possible care to their patients and to really minimize the unfortunate cases where the ball is dropped.
Right.
That used to happen. Nowadays, it's a lot more rare with this team concept.
Awesome. We're going to take a quick break, and then after that, we'll come back and finish up that conversation. So stay tuned. We'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Dr. Christopher Johansen. Thanks again for being on the program. And we've been talking about the 3D tomosynthesis and the importance, obviously, of catching it early, which is what our whole October shows have been talking about. Just before the break, we were just starting to talk about KRMC's relationship with Mayo Clinic, and let's go into that a little bit more and the Mayo approach to healthcare.
Absolutely. The Mayo Clinic has expanded with a Scottsdale location, as many people know. They don't have any further locations outside of the Phoenix metro area. We were very excited, of course, in my group, because we all had such a strong Mayo connection, when we were able to start assisting in building the connection between Mayo and Kingman Regional Medical Center. There's already a very strong connection. For instance, if a patient comes in and needs to be evaluated for an acute stroke, which is
a stroke doc program.
Exactly, a potentially life-threatening situation where someone needs to be treated within really minutes to an hour or two to get the maximum benefit from our therapies. You're able to meet with a Mayo neurologist via an internet connection.
It's kind of like Skyping, right?
Exactly. Essentially Skype with a neurologist, and as a radiologist, I work with the Mayo physicians, interpreting imaging studies in a very timely fashion to make sure that they have all the information to pursue a treatment that may only be available or helpful to the patient for a matter of minutes or an hour from the time of their symptoms. So that's obviously a very exciting position to be in as a physician here in Kingman, being able to work with Mayo. We've been able to build on that and expand that to the point where now our breast care benefits from similar connections. For instance,
I don't think I knew about that, so let's...
Sure. The Mayo physicians, obviously they have some very specialized cancer surgeons that have spent their careers taking care of very advanced or very complicated cancer patients. They've actually come up here to visit us at Kingman. They've toured our facilities. We had to get them up to speed a little bit on tomosynthesis because that's actually not yet available down at Mayo.
You said we're the only ones in the region, or so.
Absolutely. So they were very excited to learn more about tomosynthesis. And while they were up, they gave us some talks about the things that they're doing for advanced cancer treatment. And it really helped us to solidify the connection we have where patients that have advanced cancers or even just choose to be treated down at Mayo can benefit from all the things that Mayo has to offer without having to be concerned about transferring care from one institution to another.
And then back.
Exactly.
Right, because it goes both ways.
Right.
They want to make sure they have everything when they go to Mayo, but then when they come back, that again, their information comes back with
That's
them.
a great point. Oftentimes, like we mentioned, if you're changing from one doctor to another, there's the potential for that loss of information.
Right.
And when you are going from, for example, Kingman Regional to Mayo, our relationship helps to really minimize that, but it works the same way coming back. Of course, most patients will want to continue on with their general medical care here at Kingman, but they don't want to lose the benefit of all the testing and all the opinions they had at Mayo. So that connection works the other way as well. We're able to minimize repeated tests and take advantage of what was discovered at Mayo in their treatment back here at Kingman.
That's awesome. Now, we were talking about getting, like, you're doing the X-ray reports. I'm not using the right words probably there, but,
No problem.
But how do we, my understanding is there was quite a few hoops we had to get through just to be able to transfer that data or those films images, right?
So there's, whenever you transfer between one doctor to another, whether it's from an office in Kingman to another office in Kingman or from Kingman to another city or state, there's always lots of different procedures that are followed, and it's difficult to set those up so that they're effective, but yet they still absolutely respect patient privacy.
Oh, right.
The main way that we've been able to minimize any issues with that has been to open up direct lines of communication between the doctors at Mayo and the doctors here. I'll either speak on the telephone directly or via email with the surgeon at Mayo whenever we have a patient that goes down. Exactly. So by the time a patient arrives down there, they're not being seen for the first time. The doctor already knows all their background information and can simply proceed to giving them a plan as to what they're going to do to help them, rather than having to do all the background information that's already been done here at Kingman.
Well, and you were sharing too of these are doctors who specialize, for instance, in the surgeons that are specializing in cancer surgery and removal, which, I mean, we've got some great surgeons in Kingman, but they haven't had that kind of specialty.
Absolutely. Depending on what kind of surgery you need to have done, you may be better off having it here in Kingman or down in Scottsdale with Mayo.
But that's what's great, having that relationship, and you're having that knowledge, so you're able to help the patient decide which is going to be best for them.
Exactly. It's just yet another option that the patient has open to them because of that relationship that KRMC has with Mayo.
Right. Yeah, we are so blessed, and I know it's just beginning, truthfully. Every time it seems like I turn around and I hear another new conversation or another new program we're working on. And people get confused, and I'm glad you mentioned that earlier, that we continue to be KRMC, Kingman Regional Medical Center. We are now a partner with Mayo through the Mayo Clinic Care Network, which obviously gives us a whole new
dimension of services we can offer and different things for our patients.
Right.
You know, there's a role for both types of hospitals in the medical system. Mayo is a tertiary care center. It specializes in treating advanced and rare diseases. Kingman Regional Medical Center is a nonprofit community hospital that focuses on doing great day-to-day medical care, preventative care, the types of things you just need on a routine basis.
Okay.
Neither hospital can do all those things great.
Right.
It's just not possible.
That's why a partnership is
Allows us
so
both
much
to play to
value.
our strengths and do what we do best, and them to do what they do best, and for our patients to get the best of both places.
Yeah, they benefit all around.
Absolutely.
That's great. Now, what other, we talked about those surgeons coming up. Are there any other programs that we can talk about yet? That
Well,
may be
you know,
coming?
honestly, there's a lot of things that are coming down the pipeline.
Okay.
We'd probably have to dedicate a whole nother show. There's so many different connections that are growing. It's just increasing exponentially. I'm sure as we go
Kinda
forward.
like the snowball effect, right?
Exactly, exactly. The avalanche is coming.
Yep.
More and more great connections between KRMC and Mayo are in the works, I'm sure.
That's great. Well, we are so blessed to have you here and have your family. And you shared before the program, you have a new addition to the family, your first child.
We're very excited.
That's
The first
wonderful.
Johansen, born in Arizona and in Kingman, so she's now an Arizonan.
Very
we're
good.
excited to have really started to put down roots here in the community and make
That's
our move
awesome.
even more official.
Right, and we're just blessed to have that, and your whole team. Now, so you're part of the High Desert
High Desert Radiology.
Radiology. I'm
Absolutely.
sorry, I was
No
trying to remember
problem.
the right name for it. High Desert Radiology, and that's that whole group of you that have come. Is it 5 now? Or
We're at 5
5,
now.
right.
And of course, we're always looking around for other good physicians, but it's difficult to find because the top tier programs only graduate so many
Right,
students each year.
right.
We're of course all Mayo trained for residency, and then some of us have gone on to do further imaging and further training in specialty imaging areas.
fellowships and that, yeah.
Absolutely.
So that's great, and so there's a wide variety of different things that you guys are covering. Breast cancer, or
All sorts of different imaging. It's
Right.
amazing how complicated radiology has become. It's great because it allows us to do wonderful things we couldn't do in the past, but you really have to work together as a team to take advantage of them all because it's really way too complicated for any one person to do effectively and
to
efficiently.
know it all.
Exactly.
It's just
Again,
so
it's
big.
that team concept. It's
Yeah.
at play in medicine at large and just within radiology.
Mm-hmm.
Our common backgrounds allow us to really work together very well and to each specialize in our own areas so
Right.
that we can offer a higher level of care than you can usually find in a smaller area.
But at the same time, you're able to call on each other. Hey, what?
Every day
Yeah,
I
that's
run
awesome.
at least 5 or 10 cases by all my colleagues so that
Wonderful.
that patient isn't just getting my experience, they're
Right.
getting the global experience of the
The
entire
whole
group.
team. That's awesome. Well, thank you so much for being on the show again.
Thank
It's
you
always
so
good
much
to
for having me.
learn a little bit more again. And I'm glad you joined us. I hope you learned something new. I know I did. And we'll have another great guest on the program next week. We'll see you then.